Bismillah Rahman Rahim. Assalamu alaikum. This is Dr. Waqar from Child Health Matters. So today I will tell you about communication station scenario about epilepsy. It is the information giving scenario, and you are talking to a school nurse. So a school nurse has concerns because she has a child in the school who is known case of epilepsy, and that child has developed a seizures. So she wants to know about the management of the seizures, what she should do if it doesn't stop. So she wants to know about the ongoing convulsions, ongoing seizures. So this is the scenario of information giving about the epilepsy seizure, ongoing convulsions. So as you know, before I start, you should know about the in exam. You should follow the protocols, follow the template, and this template you should memorize by heart. So you should have to introduce yourself and make a repo, and you should make the repo, introduce yourself, make the repo, ask for the previous knowledge. She is a healthcare worker, so do not worry about much about the jargons, but you have to explain in the easy way. And you should address all her concern and questions, explain in details, but keep in mind that you have limited time. You have only 8 minutes, and from these 8 minutes you have 1 to 2 minutes from the introduction, repo, and summarizing, and also to provide leaflets, all these things 1 to 2 minutes. So remaining you have only 6 to 7 minutes. So keep in mind that you have to explain concise and the relevant information. So as I told you, she's a health care worker, and don't worry about the jargons because she must know about the medical terminology. At the end, don't forget about to summarize and provide leaflets and trusted websites, and you should say about goodbye at the end. So what questions she may ask from the candidate? So the scenario is that a child who is known case of epilepsy, and she is the school nurse. She wants to know how should I manage if this child developed a convulsions, because she has an experience. She had an experience, experienced her ongoing convulsions, and she is not confident. So you should give her information about the epilepsy. So definitely you tell her about the epilepsy as she is the school nurse. Before, you will ask about the previous knowledge. After all these templates, introduction, repo, ask for attendant, and then you ask about the previous knowledge. What is she know? So she told you that I have a child that developed the convulsions and I'm not confident how to manage it. So how would you tell that how to manage? So first of all, previous knowledge you will ask. Definitely, she will tell you a little bit about the management, about the ongoing conversions. Then you should have to start tell her from the how to manage when any child who develops the seizures. Then what is the management initially? So put her at the safe place, okay, and do not restrain or try to stop the seizures. Do not splash the water. Do not put anything in the mouth. Keep her in the recovery position, means keep her on the side. And this scenario, these things you can address to the mother as well, because sometimes in scenario mothers are asking about how should I manage. So these basic things you can tell to the parents as well. So keep on her side, we are saying recovery position. So what is the reason to not aspirate or to not stop breathing? And make sure that the child's head is at the soft cushion, because during checking it may hurt, it can cause the head injury. And you should observe the seizures. Do not splash the water, do not put anything in the mouth, and be calm, be patient. Usually many seizures, most of the time it lasts for 5 minutes, less than 5 minutes. So be calm, be patient, just observe what she should observe. She will ask you, shall I splash the water on him or her? And so do not splash the water, do not put anything in the mouth. You should know about it. And what she should observe if the child is, if you are telling just observe, what she should observe and for how long? She should observe for 5 minutes, less than 5 minutes. Usually seizures are stopped less than 5 minutes. And what she should observe for the types of seizures, and she should observe for the episode of cyanosis. She should observe for episode of any pallor. So these things she should offer observe. Okay, so next question she's asking, when should I call the ambulance? Shall I call the ambulance initially? No, usually you should be calm and wait. And as I told you that it is lasting less than 5 minutes. But if it is prolonged seizure, if it is more than 5 minutes, definitely call for help, call for ambulance. But before that, she should give the rescue medication. She is telling, I don't have any injections. I know we are giving her diazepam, lorazepam, but I don't have any injection. What should I do? So yes, usually we are providing the child and parents the medication, with same medication we are giving here. And you can give this medication through the route of buccal. Buccal means inside the cheek, in between, inside the cheek, inner side of the cheek and the teeth. So that is the buccal area. So that is the buccal metazolam. So you should just give this medication if seizures are prolonged, and as soon as possible bring to the hospital. Okay, so the next question she is asking, okay doctor, so if seizure stops less than 5 minutes, and okay, so other child has observed that their colleague, their student, their classmate is having a seizure. So what should I tell them? They are very afraid. They are saying, oh, what should we do? They are very afraid. They are children. They don't know what is going on. Yes, so educate them. How to educate them? Tell them about that your friend who is having a condition which is called epilepsy. In this there are abnormal movements, and he needs your help. Just take care. Don't give him any stress, because it can aggravate the things. And also you should take care while you are playing. Do not hit in his head, and take care that he is not hitting himself, and protect him from any kind of head injury, because it can aggravate his seizures. So this is the advice to the children. And after that she might ask you that, okay doctor, what should I, how can I protect her? What other things I should monitor? What other should I should do at the school? Yes, so just make sure he is not going above his height at any place in the school, and try to keep her class at the ground level, at the ground floor. And also do not allow her at the edges of the height. And when he goes to the washroom, please tell him that do not close the door. And make sure that he is taking his medication. Contact with the parents about the timing of anti-epileptic medications, and you should give him medication on time. What is the usual time of medication? Sometimes children at school, and they forget to take the medication at, or even their time, the same time of the school time. So do not delay this medication. Just make sure that you are giving the medication on time to the child. Okay, so these are the things which are you can tell to the nurse. So now she is asking from you that my one of my colleagues, she is a school nurse. She wants to know about the this information. How can I help her? Yeah, I will just provide you the leaflets, trusted websites. You can share with this information with your colleague, and if you want, we can arrange another meeting, and we will have we can have the other staff, school staff, and we can arrange another meeting. We will provide the same information to them as well. So precautions, as I told you, the precautions for the parents, for example, do not lock the washroom door, and do not yeah, in the school also swimming should be adult supervision. Swimming, do not swim alone. Other thing, you know about the seizures, that do not go to the edges of the height. Do try to avoid to go washroom. Do not lock, and try to take the shower, not the tub bath. and whenever they have swimming, they can swim, but with the adult supervision. While they are cycling, bicycling, they should wear the helmets, and better not to go on the busy road. So and it's better under supervision. So these are the things which usually even the parents, we are giving this information to the parents as well. So these are the precautions for the epilepsy. So this is the information giving to the school nurse. Other scenario in the epilepsy is the scenario you might face about the simple febrile seizures, or the known case of epilepsy, or he is not known but first time diagnosed the epilepsy, parents wants information. So these are the scenarios you might have at the epilepsy. Here there is nothing much about the knowledge of the epilepsy, but this is a school nurse. We did not explain how the seizure. Next, in the next scenario, maybe I will tell you how can we address about the epilepsy to the parents or even the teenager child. So I am conducting nowadays the mock exam, and you can contact me on my WhatsApp or you can email me, and this mock exam will help you to develop a confidence in the exam, and also it will give you strength that you will not lose the marks because of the confusion or exam anxiety or because of the stress of the exam. So if you need any help, you can contact me anytime. Thank you very much.